around when she was like 6 months old, I start remembering kind of getting like a little bit kind of obsessed about cleaning things.
That I was going to, my vulnerable little baby could get sick, and I would never want that to happen, and I'm responsible for her, and so I need to be careful, and so the OCD kind of takes a very natural part of all of us, and it in some way takes advantage of it, and then uses it against you. Is that fair to say that it went in that way? You were vulnerable.
Yeah.
It looks for what you're vulnerable to.
Right.
What are you shooting for when you wash your hands?
Is that I'm just trying to put off the feeling of some kind of worry or doubt or
About something that's risky, that's dangerous, right?
right.
So if we can go up
Something
at that
about-
level and teach you how to respond to that, because unfortunately the anxiety disorders run the life cycle. So if you and I can focus on what really they're all about and have a protocol for that, it won't matter what it throws at you. You'll know how to respond to that. So we have to disconnect from the content. I perceive the content as garbage, trash. You want me sitting around picking up the trash. As soon as I want to understand the content, I want to understand how OCD has gotten them about the content. But once I've got that, for most people that I see, we then never talk about the content again. We don't do a hierarchy on the content. We have no hierarchy on the content. It's not what we're going to do because the content is irrelevant, right? I am going to go get the content as a client. I'm going to go pick up the content to generate a generic sense of uncertainty. Say, thanks OCD, you gave me that generic sense of uncertainty. That's where I want to sit. That's what's going to be my work. So we're going to go get it, but we're not going to pay attention to it once we get it because we're only going toward it to get this generic sense. Therefore, I'm going to ask you to take both your hands and rub them against this sink. So we're going to that sink because that's the filthiest. I mean, that has the most potential for practice. So,
You said it, not me.
yeah. Well, it is pretty filthy. Now, to what degree can you say, I want this feeling right now? To what degree can you get that and be able to operationalize that in
I want this feeling. I'm trying to talk myself into it.
Okay,
I
is it
really
taking a
am.
lot? Okay, so wait a minute.
Yes.
I want this outcome.
I do.
Right? I want this
I
outcome.
really do want that outcome, but I don't want this feeling like.
Well, I don't want it, and yet I need to have it.
Yeah.
And if I need it, I'll want it.
Okay.